For example, recently, DRAP has withdrawn a syrup because it was causing a lot of complications. Many medicines are withdrawn. So what pharmaceutical industry is taking care of avoiding those errors to take place when you are manufacturing a medicine? What are the protocols that you follow? Are there any protocols?
Yes, definitely. See, pharmaceutical companies, especially in Pakistan, I would consider this is the most regulated industry in Pakistan, and it has federal regulations applying to it as well as the provincial ones. So there are systems established. Say, for example, I'd give an example of Lhasa, which is called as the lookalike enzyme rely, which is the major one of the major causes of wrong administration or wrong prescribing. And there is a whole system established by pharmaceutical companies, especially the MNCs as well as the local pharmaceutical companies. They have established systems in which they do have protocols, and especially with the integration of AI into such systems, we are able to check that. And similarly goes with the names. But unfortunately, I would refer to the recent cases of Avastin, as we all are well aware, the case of ceftriaxone, we already know that. But these were malpractices of administration rather than something which was falling under the pharmaceutical category. So the indications are, of course, devised.
Thank you very much. Nashwa, you are related to a hospital, a major hospital in the city. So what do you think in a hospital? We all know there are so many cases reported, so many errors take place. We at time threatening to the patient. Patients have lost life. So do you think what are the major protocols that could be applied, or what are the systems that need to be in place in order to avoid all that what is unfortunately happening if patients are being mistreated or being misdiagnosed or whatever you say, which is harmful to the patient whenever they come to the hospital? Any protocols or systems that you think are there, or you will suggest them to be applied?
Ji, Assalamualaikum. Thank you, sir, for having us. Thank you for having us. So I work very closely with a lot of workflows with different kinds of healthcare providers, be them physicians or nurses. Now, in terms of reducing harm, there are different components to how you can reduce harm based on who the provider is. जैसे हमने आज की डिस्कशन में देखा है, the physician's perspective or the surgeon's perspective is very unique and different. They have different goals for the patient, be it their assessment, their diagnostics, the treatment plan. That is a vision which is dedicated to the physician. Where safety falls in, where measures fall in, where systems fall in to reduce harm in that pathway is separate. That is something that is addressed separately, that has different patterns, different safety measures. If we're talking about surgery, for example, something which may seem like a very simple process, but starting from when the moment the patient arrives in your clinic, what is being communicated, what is being documented, what is going on the record, what does the patient understand from everything the surgeon is saying? And in the event of a harm happening, was that harm pre-warned, pre-informed to the patient? Was it uninformed to the patient? What are accountability measures in place for the surgeon or for the providers? So, surgeons, for example, nursing is a completely different game. Nursing ka role is absolutely separate. They are more involved with the hands-on care of the patient in a time which is vaster than it is for the physician. How to reduce patient falls, how to prevent the patient from getting harm from regular activities while they're in the hospital setting, during mobilization, during eating, to prevent aspiration, for example, to prevent medication errors. What is the process of the medication cycle? Uske humne kaun se metrics, accountability tools rakhe hain to make sure medication is being given safely.
Also, being a physician, there are a number of times we are prescribing a medicine. A patient has got a problem. He says, for example, full factor deficiency, yeah, I've got epilepsy. And when we are prescribing a medicine for that, not for that, for other reasons, we at times do not know whether this medicine will be harmful to that or is contraindicated to that. So at times we miss because no doctor can have knowledge about every disease and what medicines can eradicate it. Do you think the use of e-prescription could be effective in that, or still the use of our own intelligence in that will be more effective?
I think, sir, you have rightly pointed out electronic medical record or e-prescription can help reduce it, magar it cannot eliminate it. Healthcare industry is supposed to be an industry which is far less regulated than many other industries like flying industry. People who are flying jets and airlines, they are far more meticulous in their approach, whereas the number of people suffering at the hands of medical error is far more. In USA alone, medical errors have become the third leading cause of death. Of them, there are 250,000 every year. Half of them are preventable. And sir, 250,000 makes it about 680 per day. That is like 1.5 jumbo jet going down every day. And look at the time, look at the method, look at the money that is being spent on airline safety compared to healthcare safety in our profession. So something we are doing is absolutely wrong, and it requires a paradigm shift.
So what do you suggest? Like, as we have very correctly said, there are a number of prescribing errors that we are making. Even the most serious ones make an error in prescription, and they miss on the history of the patient because EMR is very good, it's a new thing. But practically speaking, as we have been working in a government sector hospital, the prescription when you write a government sector hospital in an OPD with 300 patients standing and you have to pass within 3 to 4 hours, it's not possible to go for an EMR for each one of them. Either it should be a limited number of patients that we are seeing, but we are seeing an uncounted number of patients. उस कंडीशन के अंदर what do you suggest, what protocol or what safety measures could be undertaken कि आप either it should be at the end of the prescribing doctor or the pharmacy which is issuing should take care of that when the pharmaceutical after prescription जाए that this drug should not be given to this patient or the dosage is not correct. What do you think? How could it be counteracted?
I think, sir, you have highlighted the issue in your own question that it cannot be anyone working in isolation. What we are doing right now is working in silos. Physician working as a physician, pharmacist working there. EMR, I don't think is going to be the solution in Pakistan. There are two things. I am an old school. I believe that if you spend quality time with the patient, that not only builds trust, it also ensures patient safety and it also ensures quality care to the patient. But at the same time, we have to think differently. The money cannot go to the armed forces of Pakistan and our patients deprived of their due rights. ये कहाँ पर होता है कि 1% GDP से भी कम हम एजुकेशन